Imagine you or a loved one is pregnant with your first baby. You're so excited to meet this bundle of joy. And although you are fairly healthy, you have not attended any of your doctor's appointments since your first visit. All of a sudden, you're experiencing extreme abdominal pain and profuse bright red vaginal bleeding. You are rushed to the hospital and an emergency cesarean section is performed. The baby is born preterm. He comes out blue, limp, and lifeless. He is not breathing on his own and not responding to resuscitative measures. Ultimately, he does not survive. Upon further assessment of the mother, it is noted that her blood pressure is extremely high and is the probable cause of this placental abruption. Had the mother attended her prenatal visits, the doctor would have been aware of her high blood pressure issues and could have provided appropriate interventions. I am a labor and delivery nurse, and I have witnessed situations such as this one. Today I will talk to you about the importance of prenatal care. I will discuss the complications that may arise with the mother or infant, and I will discuss interventions to promote a healthy pregnancy. First, I will discuss some of the complications that can arise from little to no prenatal care. One problem is the birth of the preterm infant. This can cause underdeveloped organs, which may cause many different types of problems, some of which include respiratory distress syndrome, which causes a difficulty for the infant to breathe, and it can also cause an inability for the infant to maintain its body temperature. Also, with the preterm infant, there is a high mortality rate. Next, a mother with gestational diabetes often will give birth to a large for gestational age infant. This causes an increased risk for a cesarean section or a shoulder dystocia. Also, the infant may have low blood sugar due to the mother's gestational diabetes. And finally, pregnancy-induced hypertension. Placental abruption, such as the one as I previously stated, can cause massive hemorrhage and ultimately lead to maternal or infant death. Also, pregnancy-induced hypertension can cause maternal seizures, and the mother needs to be closely monitored during the labor process. Now that I have discussed some of the possible complications, let's talk about some simple interventions. Prenatal visits consist of baseline vitals, labs, and weight. It also teaches the patient a healthy diet, activity, and lifestyle. And it also encourages the patient to take prenatal vitamins, avoid certain medications, foods, drugs, and any other harmful substances. Prenatal visits also help identify maternal risk factors. For example, age. Younger patients are less likely to obtain adequate and consistent prenatal care. And according to Adele Pelletieri, older patients have an increased risk of having an infant born with a birth defect. During the visits, it is important to assess the availability of resources, whether it be food, clothing, shelter, or transportation. It's important for us to assess our patients' needs. Prenatal care is a simple way to prevent serious problems during pregnancy. Pelletieri states preterm birth, gestational diabetes, and pregnancy-induced hypertension are just a few of the many complications that can arise from inadequate prenatal care. In conclusion, prenatal care is essential to pave the way for a healthy future for the newborn. Adequate prenatal care can help prevent the occurrence of devastating tragedies.